Bismillah Rahman Rahim. Today we shall discuss how to use a resmetirom in fatty liver disease. The dosage forms and strengths. The resmetirom is available in the tablet form in the 60 milligram strength, 80 milligram strengths, and 100 milligram strengths. And it is given on daily basis in patients who weigh more than 100 kg. They are given 100 milligram tablet per day, and those whose weight is less than 100 kg, 80 milligram daily dose is given to those patients. It may be administered with or without food, so no effect of the food on this drug. And it should be stored at 20 to 25 degree centigrade, and for short time it is permitted to be stored at 15 to 30 degree, but ideally it should be stored at 20 to 25 degree centigrade. What about the drug-drug interaction? A very important point. If the patient is using clopidogrel, because these are metabolic syndrome patients and they may be on these drugs, so if a patient is on clopidogrel, then in patients who weight is more than 100 kg, 100 and more than 100 kg, reduce the dose of resmetirom from 100 milligram to 80 milligram. And those whose weight is less than 100 kg, reduce the resmetirom dose from 80 milligram to 60 milligram on daily basis. If a patient is using gemfibrozil, then don't give that patient resmetirom. Resmetirom is not indicated, rather it is not recommended to be used in combination with gemfibrozil. If your patient is using statins, so you need to check on the dose of the statins. Those who are using atorvastatin, limit the daily dose of atorvastatin to 40 milligram or less. Those who are using rosuvastatin, limit the daily dose of rosuvastatin to 20 milligram. Those who are using simvastatin, limit the daily simvastatin dose to 20 milligram. And those who are using the parovastatin, limit the daily dose of parovastatin to 40 milligram. Those who are using pioglitazone and they are also using resmetirom, then monitor for pioglitazone related adverse reactions. This is warranted. And if your patient is on warfarin, then there is no clinically significant interaction observed, and the patient should be given the same dose of resmetirom. So this is very, very important, because those patients who will be needing the resmetirom, they will be having the other medications as well, and on a long-term basis, and clopidogrel, gemfibrozil, statins, pioglitazone, or warfarin. So in that case, you need to be careful of the drug-drug interactions, either in the reduction in the dose of resmetirom or the reduction in the dose of statins, or not giving resmetirom. So with this, I pay thanks to you for being with me. Inshallah, in the next vlog, we shall be discussing the safety and tolerability of the resmetirom in patients with fatty liver disease. Till then, take care. Khuda Hafiz.